Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is what you need to know about fibromyalgia. Fibromyalgia is a connective soft tissue disease involving chronic, spontaneous, and widespread musculoskeletal pain, along with recurrent fatigue and sleep disturbance. That's right out of McGill's medical guide. The condition presents with multiple tender spots on the body that are typically found on the back, neck, chest, hips, arms, and legs. It used to be that fibromyalgia was referred to as chronic pain syndrome, psychogenic rheumatism, or fibrositis. They all mean the same thing. 3.4% of women in the U.S. and 0.5% of men have fibromyalgia, with a typical age range between 30 and 50. 3/4 of those with fibromyalgia actually go undiagnosed. How do you know if you have it? Well, there's American College of Rheumatology guidelines that says history of several areas of aches or pains for a minimum of 3 months, have at least 11 of 18 locations on the body that are significantly tender, and if it's close but not quite fibromyalgia, it's called myofascial pain syndrome, but it receives the same treatment. There's also JAMA guidelines from 1987 with major and minor criteria. Major criteria would be generalized and chronic aches and pains or stiffness over 3 months in 3 or more regions, multiple tender points, and then no other identifiable condition that the symptoms present. So it's a differential. Doctors will go through, okay, it could be this, could be this, could be this, and then if it's not that, it falls into fibromyalgia. And then you can see the minor criteria below. Oftentimes it does become a diagnosis of exclusion. A doctor will go through, as I mentioned, this, and this, and if it just doesn't fit, then fibromyalgia is the diagnosis. Now, what are the treatment options? Mayo Clinic looked at a ton of studies back in 2005, and they found that alternative medicine options work very well. That may be acupuncture, chiropractic, physical therapy, massage, aromatherapy, homeopathic medicines, spa baths, relaxing herbals, music therapy, and yoga. Some people just don't tolerate massage and manual touching with fibromyalgia, so these are not all going to be applicable. Now, when you start getting into medication management, there are some off-label medications such as antidepressants that help, nonsteroidal anti-inflammatories, muscle relaxers, Tylenol, which is acetaminophen, opiate medications, membrane stabilizing drugs such as Lyrica, sleeping aids, and then Myers cocktail is an infusion treatment that involves a lot of minerals and vitamins. There are some FDA-approved medications for fibromyalgia. The first one was Lyrica back in 2007. Then came Cymbalta the following year, and the year after that, Savella. We don't know how any of these work, actually. We just know that they work well for fibro. Myers cocktail had a pilot study years ago that showed most subjects experienced relief as compared to baseline, but it wasn't a large enough study to have statistical significant findings. And that's okay. That usually just means that it needs a larger study. There is no cure for fibromyalgia. It is a challenging condition, but the National Fibro Association says the best treatment is multimodality, meaning it would include both the traditional treatments and alternative, such as I showed. The top non-operative pain management is through the Georgia Pain Network. There are multiple clinics throughout the state accepting over 50 insurances and providing over 25 different treatments with the board-certified doctors. Visit us online today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.